All right. Hello, everybody. Thank you for stumbling upon Resident ENT with myself, Josh Dramiella. This is a channel where we'll be providing short videos, anywhere from 2 to 5 minutes, on common otolaryngology or ear, nose, and throat topics that are probably best for medical students on their ENT rotation, or maybe junior residents who need to brush up on a case just before. So the very first topic for the very first video here is going to be cervical fascia. So, sorry for the terrible production value, but I don't want to get in trouble for using somebody else's photos. But let's talk about this for a minute. So this is really important for soft tissue head and neck surgery in the neck, and it's also important for consultations regarding infections and injuries in the neck. So without further ado, let's draw out a picture. So this is going to be the neck, and we're going to think about this as if we're looking at the anatomy radiographically. So the top of the screen here is going to be your anterior aspect, while the bottom part will be posterior, and then we have the patient's right and the patient's left there. And this first layer here is the skin, which we should all be familiar with. The next layer, however, if you were going to make an incision just under the skin, you're going to have some subcutaneous fat. But more importantly, as this topic is fascia of the cervical anatomy, the first layer of fascia is going to run around just under that subcutaneous fat, and it's going to contain a muscle from about here to here and here to here that's continuous with the SMAS, and that muscle we all know is called the platysma. And this very first layer of fascia is going to be the superficial cervical fascia. So that should be easy enough to remember. However, when we get to the deeper layers, they are technically all deep layers of cervical fascia. So the name will get kind of confusing, but bear with me and we'll parse it out together. So the next layer of fascia is going to encase these two large muscles on either side here that we know as the SCM, or the sternocleidomastoid. It's going to also include the muscle posteriorly in the back of the neck, known as the trapezoid, or the trapezius. It also includes the strap muscles, which for time's sake I'm going to group all of them together there, and we know there are 4 strap muscles on either side, and we can name those out in another video maybe. But more importantly, all of these muscles are encased in what is known as the superficial layer of the deep cervical fascia. The superficial layer of the deep cervical fascia. So keep those in mind. The platysma is encased in the superficial cervical fascia, while the strap muscles, the SCMs, and the trapezius are all encased within the superficial layer of the deep cervical fascia. So this is all deep to the platysma. The next layers, just to keep things from getting too complicated, I will kind of break them up into their 3 parts. So we have one all the way in the back that we will draw that way. We have one in the front here that we'll draw as a big circle. And then we have 2 more on each side that will also draw as circles. So the first one, and should be the easiest one to recognize, is going to be the carotid sheath. You're right, it doesn't get the fancy title of fascia, but it is a layer of deep cervical fascia. And this contains 3 important structures we should all know. We have the internal jugular vein, the common carotid artery, and the vagus nerve, or cranial nerve 10. The green fascia here is going to contain a few things, some very important things. Most anteriorly, depending on where we are in depth, is going to be the thyroid. Just behind that, we're going to have the trachea. And just behind that, we're going to have the esophagus, or the goose. Finally, in the very back here, because I am not a neurosurgeon, I am not going to respect the exact anatomy drawing of it. We're going to have the spine. So let's talk about this a little bit more. These are all layers of deep cervical fascia. The one that we have labeled red, we'd already talked about. This is the carotid sheath. The one that we now have labeled green is known as a couple names. I like to call it visceral fascia because that's how I learned. So we have the visceral layer, but we also sometimes see it called the pretracheal. And that gets a little bit tricky because it is one continuous layer, and when we call it pretracheal, it sounds like it's just the fascia in front of it. So more to come on that. But finally, we have this layer that we notated in black, and this is known as the prevertebral fascia. All right, which basically encases the spine. So one thing here that I neglected to do, I don't have another great color to use, was to point out that there's 3 layers posterior to the esophagus that we really have to understand. And so let me just delineate these a little bit better. So just behind this posterior layer of the visceral fascia, there is up high in the neck where we're at now is another layer that creates a space in between it, and it separates the visceral fascia from the let's just connect these because that's what they're like anatomically. And this is what separates the visceral fascia from the prevertebral fascia. And the reason this is so important is because everybody gets this confused, and I've even seen a ton of photos on online that have the wrong notations, and it drives me crazy. So if somebody likes to use the term pretracheal fascia for the first part of the visceral fascia, then what they like to use for the posterior part here is the buccopharyngeal fascia, because it's all continuous up high with the buccopharyngeal fascia. And so this next layer that we've now notated in orange is a little bit confusing now, is really called alar fascia, which unfortunately is a name that we see all over the body, so it's not very distinct. But really, how everybody knows it is the party wall. All right, so that's the party wall. And the reason that's important, again, is because it separates the pretracheal or the visceral fascia or the buccopharyngeal fascia from the prevertebral space. And I keep saying that's important, and I'll tell you exactly why. Because the space in between the alar fascia and the prevertebral fascia is continuous with the mediastinum. So if I was to draw that as another picture, sorry again for the terrible art. So this is somebody's chin. We'll say that's their mouth, lips and nose. As we're looking at these layers, what we have is we have the prevertebral fascia coming all the way down, to where the heart lives. And then we have and we'll just draw it as a cylinder, and then we have the visceral fascia coming down this way, and we have the alar fascia or the party wall coming down to connect here, and we create these 2 very distinct spaces. Okay, so this is going to be known as the retropharyngeal space. You get the idea. While this is going to be known as the danger space. And that's not my term, that's what everybody calls it. This is known as the danger space. And why this is important is because if somebody were to develop an infection in the retropharyngeal space, which we commonly see in the pediatric population with lymph nodes that become suppurative, or they were to have surgery in that area, and they were to have their alar fascia or their party wall violated, well, now we have spillage of everything from that space going into here and creating the stew or the pot or the concern for mediastinitis. And so that's kind of everything about cervical fascia in a nutshell that you should need at the level of a medical student or a junior resident. So let's just talk a little bit more about PIMP questions. So some of the PIMP questions that attendings like to ask, I alluded to one of them. So we know that the superficial cervical fascia contains the platysma, and so the question is always, what is the platysma continuous with superiorly? And that's the SMAS. We can talk about the SMAS in another video. Another discussion that people like to ask, or another PIMP question that people like to go after is, what's the orientation of the great vessels and the vagus nerve in the carotid sheath? And you just need to remember that the IJ is lateral, the common carotid is medial, and the vagus nerve is behind them or posterior to the two, kind of within that little crevice there. And that's same for the other side as well, which we did not draw, so I'll draw it. So the IJ is going to be lateral, the carotid is going to be medial, and the vagus or cranial nerve 10 is going to be in between the two. Then finally, just off the top of my head here, the last PIMP question to kind of know about is, if somebody does have their alar fascia violated and they're at risk for mediastinitis, what is the first clinical sign of mediastinitis? And that is going to be tachycardia. So there you have it. One more time, we'll just show my terrible drawing here that highlights everything you need to know. So the first layer, of course, is going to be the skin, the epidermis, the dermis, and then we're going to have some subcutaneous fat. But just underneath that, we have the platysma, which is contained within the superficial cervical fascia. Just under that, we're going to have the muscles of the neck, the big muscles of the neck, the sternocleidomastoid, the strap muscles, and the trapezius, all encased within the the superficial layer of deep cervical fascia. Then within the neck, in the remaining deep cervical fascia layers, are going to be the visceral, anterior, that is pretracheal, posterior, that is buccopharyngeal, but altogether it is the visceral fascia. We have the carotid sheaths, which contain the great vessels and cranial nerve 10, and we have the prevertebral fascia, which is protecting the anterior neck from the spine. Again, when we look in between the prevertebral fascia and the visceral fascia, we find there's one extra layer called the alar fascia, or the party wall, that helps separate the retropharyngeal space from the danger space. Again, just to confirm it one more time on here, the retropharyngeal space from the danger space. And there we go. So I hope this gives everybody a good review. If you have any questions, you can always leave me comments below. And if you have any topics that you'd like me to cover, I'd be happy to do so. Just let me know what you think, if this was useful, if it wasn't, how we can improve. Sorry about the terrible production value, but this is all I got. So I hope you have a good day, and bye.